experiencing hallucinations, not on medication.
Mental health teams like these have responded to more than 32,000 calls across San Diego County since 2021. Local behavioral health leaders say proposed state budget cuts are threatening the future of those services. Nadia Pravari-Brahms is San Diego County Behavioral Health Services Director. She says a funding commitment from the state led them to expand services to tribal communities and schools.
And over the last 18 months, our teams have responded to more than 600 calls in schools.
Under Governor Gavin Newsom's budget proposal, mobile crisis response would no longer be a mandatory statewide Medi-Cal benefit beginning in 2027. Brahm says that would shift more of the cost to counties. San Diego County says the local program cost about $24 million a year. Right now, it's paid for primarily through state and Medi-Cal funding. The county says to keep the mobile crisis response teams, it would have to cut another program.
Without those teams, law enforcement would have responded, which often escalates situations and can be stigmatizing for children.
Even when officers are compassionate and well-intentioned, they don't have as much training in terms of behavioral health responses, especially in a crisis situation.
Dr. Charmi Patel Rao is a youth psychiatrist. She says mental health professionals are trained to recognize psychiatric distress, de-escalate, and connect youth with support. She says the response youth receive during a mental health emergency can have lasting effects.
Unfortunately, when youth and families experience that the response is traumatizing or punitive, then they may avoid seeking help in the future.
County behavioral health leaders say if state funding disappears, school and families could lose access to mental health teams designed to respond to psychiatric emergencies before they become even more serious. The governor and legislature are expected to finalize the state budget in the coming weeks. Heidi de Marco, KPBS News.